Creatine is an amino acid derivative that is synthesized endogenously, and over 95% of creatine in the body is found in skeletal muscle. However, recent years have seen a shift in interest in creatine research to the brain. We know that creatine is synthesized endogenously by the brain, although there's limited uptake across the blood-brain barrier. We also know that there are rare genetic conditions known as cerebral creatine deficiency syndromes, which are a rare group of inborn errors of creatine metabolism that are characterized by disordered brain creatine biosynthesis, resulting in impaired neurological development and function. Now, whether creatine supplementation improves cognitive function in otherwise healthy adults remains relatively ambiguous based on current evidence. But a recently published intervention trial has generated a lot of hyperbole on social media. An example in this post here, where the findings are being communicated as the data doing the talking. The problem is the data itself. Enter DRG.
So what did the researchers do? Well, firstly, they took only 36 women, not the 46 some influencers claim, and divided them into 4 groups of 9. Now, already that's a problem because that is a tiny sample in each group with a lot of variance and give you misleading impressions. But to make matters worse, they didn't just compare these 4 groups with one test. They threw 15 different cognitive tests at these groups. And then they just reported if any of those subgroups had a difference between them, and they called that significant. Except that's meaningless, because if you throw literally 60 tests at a bunch of data, some of them will be different by chance. That's exactly what you'd expect. And to make matters worse, the trend didn't even support their idea. For example, in one group, they saw a difference in the medium creatine group, except it wasn't in the high creatine group. What this shows you is this is artifactual. This is a terrible way to design a test, and that's a real problem, because you're reporting noise as a result.
And the noise that they're reporting as statistically significant was primarily based on within-group changes over time. There was simply no difference in either of the creatine supplementation groups compared to placebo for mental fatigue, which was the primary outcome that they didn't report, and the general fatigue measures and the menopausal symptoms.
And just take a second to look at the conflicts of interest of this paper. The people that are promoting this paper, that research this paper, are selling the creatine and supplements that they are ostensibly testing. Now, that doesn't mean they're corrupt necessarily, but it does tell you that's the thing you need to be aware of, because they have a vested interest in the results being a certain way. So either by wishful thinking or deliberate manipulation of throwing a bunch of inappropriate statistical tests together.
And those conflicts are relevant because the weight of evidence for creatine supplementation is for creatine monohydrate specifically. The authors of this trial tested a creatine hydrochloride and mixed creatine hydrochloride ethyl ester that are creatine derivatives with unproven efficacy and effectiveness. If anything, this trial simply adds to their unproven efficacy and effectiveness.
Is this good research? No, I would call this research waste. And I would say that any influencer pushing it or telling you this is a big deal doesn't really understand research methodology, and maybe is trying to sell you something themselves. And maybe are not the kind of people that you should be getting your health advice from.
So in summary, this study does not support the claims that are being pushed around social media in relation to it. It simply found that creatine hydrochloride or combined hydrochloride ethyl ester was not superior to placebo for the vast majority of the outcomes, and the outcomes reported as statistically significant were either within group or statistical artifact. And we just need better research to be conducted before we can make any conclusions of the potential role of creatine supplementation in cognitive function in otherwise healthy adults.